Hi, and welcome to the Muslim Sex Podcast. This is Dr. Sadaf Lodhi, and I would love for you to leave me a review of this podcast and also to share and like it and share it with your friends, see what they think, and let me know. I would love to shout you out on social media. And also, I would love for you to follow me on Instagram at Dr. Sadaf OBGYN, as well as TikTok. I also have started a YouTube channel at Dr. Sadaf Intimacy Coach. I'd love for you to follow me on all of those channels. And most importantly, I'd love for you to become a patient. I am now accepting telehealth patients for sexual health as well as menopause health in New York and Michigan. So if you are a woman that is looking for a doctor that understands you and can actually take the time to listen to all of your concerns, reach out to me. Reach out at Dr. Sadaf at drsadaf.com. And I would love to see you as a patient. And now for the episode. I'm an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodhi, and this episode is everything you need to know about GI disease and how that impacts your life and intimacy and relationships and where to go from there. But before I get into it, the first thing I want to make very clear is that I am not giving any type of medical advice. So if you have any issues with your health, please see your friendly neighborhood medical provider. And if you're having any issues with your religion, please speak with your friendly neighborhood religious leader. So this is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So welcome, Dr. Vivian. And I'm so happy to have you on. And if you could please introduce yourself to the viewers and listeners out there.
Hi, thank you so much for having me on the Muslim Sex Podcast. I'm excited to be here. My name is Dr. Vivian Asamoah. I am an integrative gastroenterologist based in Katy, Texas. We practice a little bit of a different kind of gastroenterology care where we blend the best of both worlds, right? Conventional medicine and a more holistic functional medicine approach. And I'm so happy to be here.
That's fantastic. Can't wait to get into this because I'm really interested in what you do and in your functional medicine approach. I think that that's really the holistic approach is really the way to go, especially when you deal with a lot of disorders, right? I would say really everything in life really requires a holistic approach and, really assessing what's going on with the patient and person. So, I am really curious and interested to find out, as I'm sure the listeners are, on what type of patients you typically see and what's going on with them.
So we see a patient with a variety of symptoms. I think it's more important that I talk about symptoms and
Yeah,
rather than label the patient with a diagnosis, right? Because
perfect.
it always starts somewhere. So, we see a lot of patients with abdominal bloating, like severe abdominal bloating, patients who are suffering with constipation. And by that, I mean like they don't go for, several days, they're skipping days, it's uncomfortable. And then, patients who have like pelvic pain. So we actually
Mm,
see a lot of patients who have endometriosis,
yes.
which is related to, as you will be the best at explaining this, but can cause a lot of scarring in the lower abdomen, and that scarring can also affect the bowels. So that's why they come to us, and we see, then we see patients with some chronic inflammation problems, inflammation of the gut, like inflammatory bowel disease, Crohn's disease, and colitis. So that's just to give an array, but we go down even further where we see people coming in, and of course, as a female gastroenterologist, we see a lot of women with hemorrhoids, anal fissures, rectal prolapse, where the rectum is coming out a little bit, and fistulas, where there's a like drainage, chronic drainage tracts formed in the lower in the anal rectal area. So a big variety of different issues.
Right. Right. I guess the fissures, probably can be a result of a lot of trauma, right? Or chronic disease, like you have Crohn's disease that can cause that. Probably also sometimes even in childbirth, when those women have those fourth degree tears that go into the rectum when they're having a vaginal delivery.
Absolutely. We can see that's absolutely true, Doc. We can see fissures from people who have constipation and have a large bowel movements. We see
Sure.
fissures sometimes from people who are having anal sex. We will
Yes.
see fissures in people who have had, episiotomies, and there's some weakness in that anal rectal area. So just like you said, and then with Crohn's disease as well. Yes.
Right, absolutely. That's interesting that you should mention anal sex. So, what is it that you typically see? You see like connections when you say like fissures. Is that are the fissures? Are they typically the same type of fissures that you would see? So, just for the audience that may not understand what we're talking, what is a fissure?
So great. It's a fissure is really just like a cut or a tear in the
Right.
anal rectal area. So it usually starts from right inside the edge of the rectum and it comes out to the anal area. So sometimes if you put your finger right there, you can actually feel exactly on which side it is, typically anterior or posterior. And the cut feels very raw. A lot of people describe it to think they describe it as I feel like I have razor blades coming out of my anus when I have a BM. It can be sharp, almost electric, because it gives a nerve type of discomfort, nerve pain discomfort. So that's what a fissure is. It's a cut. And over time, it will heal, but it takes a really long time. And it doesn't heal if the issue of constipation or constant trauma is still there, right? It's still ongoing. It takes it a lot longer to heal.
And what happens if that fissure never heals?
So if the fissure, we try and treat the fissure. We usually will start by saying, make sure your stools are soft. Make sure you're not straining. Make sure you're not hyper contracting that anal sphincter, because that tightness in that anal sphincter is what allows it not to heal and even cause additional fissures. So make sure your stools are not
Oh,
soft. You're not hyper contracting that anal fissure. We usually recommend a compounded cream, one that typically helps relax the anal sphincter, usually a combination of either nitroglycerin with a lidocaine or diltiazem, anything that will help relax that muscle, right? And if that doesn't work, we start talking to our colorectal surgeons about offering options like Botox injections at that anal sphincter to
wow.
relax the muscle. It's all about that muscle relaxing and allowing it to heal. And if that still doesn't work, then we look at actually slicing out that fissured area to allow the mucosa, the tissue, to heal. And that's what we call a fissurectomy.
Wow, I never even knew there was such a thing. That's amazing. Fissurectomy, wow.
Fissurectomy.
Um, so, yeah, I mean, I'm just really, I guess, I guess I've never really thought about this too much, but this is fantastic. So, for somebody that may suffer from fissures, and you gave us a few of the reasons why somebody may have such, what would you recommend? You said soft stools, and you said, I guess, for somebody maybe drinking a lot of water, or do you recommend like Miralax or magnesium or something like that to
Yeah,
help?
so working with the underlying, trying to fix the underlying problem, like the root issue. If it is constipation, then you want to reverse that. And so start with diet, right? Nutrition, eating lots of, rich fiber rich foods, plants based foods, so vegetables, making sure you're getting an adequate amount of fruits and vegetables in your diet. And then just like you said, Doc, hydration, right? They say we should be drinking about half of our body's weight
I
daily.
know.
I
That's a
know
lot.
I weigh 160, so I should be drinking 80. I don't even think I drank 30 today. So 30
Yes.
ounces. So we'll have to keep drinking. And then, a small tip, just make sure that you are not sitting on the toilet for too long. Like you just go
Mm,
in and you do your business. You're not straining and spending time straining. You're not reading or texting or, looking at your phone while you're sitting on the
right.
toilet, because that's all pressure that will lead to excessive straining and even hemorrhoids prolapsing down. And so those
Interesting.
are a few little things you can do. Sitz baths, which is just sitting in lukewarm water, perhaps with some Epsom salts. That's more soothing and for healing. So those are all things that we can do initially to help heal these fissures, right?
I wonder if, you're talking about not sitting too long on like the toilet and stuff like that. I wonder if for somebody that like sits at their job all day, do you think that adds to, increased risk of hemorrhoids?
Absolutely. So that, the people we know will have hemorrhoids very commonly, or who are, we'll say, higher risk, are truck drivers. Truck drivers.
Ah,
And now I feel like we're all truck drivers, right? Because we're all
yeah.
sick. But truck drivers are sitting like on in one spot, and they can't
Oh
even
man.
move for a long period of time. So I see a lot of truck drivers with hemorrhoid issues, and then people who lift weights and lift heavy weights simply because of that maneuver of just contracting the abdominal wall and bearing down, that bears down the hemorrhoids as well. So weightlifting also associated with increased risk of hemorrhoids, just like cycling, long cycling, going for really long rides and sit in that sitting position also increases your risk of hemorrhoids formation.
Wow, I feel like you can't win. Like you're
I
trying to
know.
exercise.
Take breaks. Take breaks. As they say, everything in moderation, right?
Yeah, yeah,
Right.
no, that's fantastic. So I am curious actually. So let's, I've been so fascinated by this topic. Um, so, what I am curious about is, when you see all of patients that have issues with GI, like bloating and discomfort, and, maybe it's flatulence, maybe it's, a whole bunch of GI issues. How does it impact their intimacy? Do you ever get into that? Do you ever talk about that? I imagine that it would affect it.
I wish you talk about it a little more. Women, of course, and men, actually, I would say men are very shy,
Yeah.
or don't feel comfortable about having this discussion. But the one thing I will say, Doc, is that when we are dealing with, we are working with women who suffer from symptoms like irritable bowel syndrome, right?
Yeah.
And there's a criteria called the Rome criteria about how to define irritable bowel. But irregular bowel habits, abdominal pain, bloating going on for months, happening in flares. A lot of studies have shown that there's a strong association with post traumatic stress issues and even
Oh,
history of sexual abuse in the past, right? Some kind
wow.
of abuse. So a lot of PTSD sort of precedes IBS symptoms, which is irritable bowel syndrome. So when someone has had this diagnosis, comes with the diagnosis, or you make this diagnosis, be it male or female, it's important to kind of look at the history and try and get a little bit deeper about whether there's any history of trauma.
Mm.
It's really important because that could be the cause of what we now call the gut brain axis disorder, stress
Oh, tell
in
me
the
about that.
brain.
Gut brain axis.
We probably should have like 3 podcasts on we, we jump to a whole different topic, right? So much to share. So just, we believe there's a connection between the gut and the brain, right? In terms of neurotransmitter feeding, and so stress and anxiety causing issues in the brain, causing symptoms in the gut, because a lot of the same neurotransmitters in the brain are actually in the gut as well, like serotonin, melatonin,
Oh,
heavily produced in the gut. We probably have more of those neurotransmitters than actually in the brain. So that's why someone who is stressed out before giving a presentation or a talk will have butterflies in their stomach. Why not
oh,
butterflies in the ear or butterfly in the leg? It's in the gut because the neurotransmitters are there. And when serotonin is released, they attach to those receptors and stimulates the gut to start moving around and making, the motility is all perturbed because of that connection. And that's in part the diagnosis of irritable bowel syndrome. It's a functional disorder, it's a motility disorder. And so any triggers from post trauma or past traumas could potentially trigger symptoms there too, right?
so interesting. Yeah. I mean, like I know that like there are some people right before a big presentation, right? You talk about the butterflies in the stomach, but actually, I feel like for some people, that's like a GI irritant, right? Whenever they get nervous,
Yes.
then they have to go to the bathroom, or they get diarrhea, or something
Absolutely. It's all
happens,
in the guts. Yes. Same
right?
process.
Or they feel nauseous,
Yes,
or
and
they
they
feel
some
sick.
even vomit to a point where
Yeah.
they actually throw up when they're super stressed out. Absolutely. So just
Mm.
imagine the impact of stress and anxiety, and the impact of the brain on the gut is really, really significant. So going back to your question about patients with IBS and how it affects them. So even before talking about intimacy, after you've met a patient a couple of times and you've developed a rapport and a sense of trust, I think letting them know that some of these symptoms, one, could be, exacerbated by stress and anxiety. And are there any stressors or trauma, past, present, that they would like to discuss? That's the first sort of place to start. And, when you have IBS, it affects you in so many ways. It just affects your quality of life in so many ways that, as you know, women, and I won't hesitate to say men, are often, more lean or more excited to have sex when the mind is there, when they're calm, when they're in the mood. But when there's a lot of stress and everything going on, most likely not really they won't feel like having sexual intercourse with their partners. So if you have IBS and you have a chronic bowel issue, chronic bloating, chronic discomfort with underlying anxiety or even trauma related to that, that can significantly affect your desire to have sex, right? Your desire to have sex, and your even maybe the way you perceive it and enjoy having sex as well. I think gut issues can certainly affect that.
Wow, there's so much there, and when you talk about patients that have experienced trauma, right, and how that trauma is exhibited, I mean, you can absolutely see how that would affect their desire to want to be intimate with somebody. And I guess until they were able to work through their trauma that they've had in the past, right? So with us as physicians, and you, I'm sure, also as a holistic physician, more so than anyone else, is always working to get to the root cause of the problem and not just treat their symptoms. You're trying to figure out what is going on. And so that, I'm sure, is really important. And so trying to, guide the patient and then sending them to perhaps a therapist or somebody that can help them with their trauma that they've had in the past so that it can then improve their GI symptoms, which then will allow them to be intimate with their partner. And I love how there is that gut brain axis. I feel like the brain is so powerful, right? I mean, the brain is just, I mean, the brain is the brain, but it
Brain,
really is.
brain.
Yeah, I know. It's a powerful quote. But it really is. I mean, it really is so powerful when you think about it. I mean, in sexual medicine, we know that the brain is the biggest sex organ.
Mhm.
And right. And that if you are mentally not there, in the sense that you're not, mindful during your experience, whether it's sexual intimacy or emotional intimacy or whatever, that nothing else is going to work right because you are not present in the moment. You're not being mindful. And we know from studies that when a person is mindful, when they're sexually active or in, being intimate with their partner, that automatically will increase their arousal and their libido.
Mhm.
And so I love how, of course, there's also, it only makes sense that there would be a gut brain axis
Connection.
as
Yeah,
well. Yeah, yeah,
really.
yeah.
Very true. Very true.
So, what else do you commonly see in your? I know there's so much that you see, but as it relates to say like intimacy and relationships, I'm sure that if a patient is having like rectal bleeding, or if they're having other issues in terms of irritable bowel, right,
Mhm.
that they're not gonna have it. Um, are there any symptoms that you would tell a patient that, if you're experiencing this symptom, this is like a red flag, and to make sure you go to your provider right away?
Absolutely, absolutely. There are symptoms that are red flag symptoms that warrant getting a procedure or at least getting a consultation and most likely getting a procedure like a colonoscopy, one of them being rectal bleeding, right? If you're seeing rectal bleeding, that is definitely a concern. Or if you notice a sudden change in your poop, right? In your BMs, in your bowel movements, that is also a concern when it's sudden and you can't attribute it to anything else, like, oh, I changed my diet or I started a new medication. Then it's important because we always want to rule out a diagnosis of cancer. That's super important.
Mm,
But you
mm.
asked another question, Doc, about what other conditions could impact sexual desire or even pleasure during sex or desire to
Mhm.
have sex. And I think the biggest one we see is inflammation in the gut. Like, and so I
Mm.
refer to our patients with Crohn's disease and colitis, where there's actually, when we do a colonoscopy, we can actually see ulcers and
Oh,
inflammation. And remember
wow.
that the gut, the colon dives deep into the pelvic area, which sits, it's basically what you have is you have bladder, you have uh, uh, uh,
Uterus.
uterus, rectum, right? So they all sit right next to each other, back to back. So something that's inflamed in one area will definitely affect the uterus and the vagina, and will definitely affect the bladder wall as well. And so when our patients with Crohn's disease have colitis or ulcerative colitis, have inflammation and ulcers, and things are not moving well and they're bleeding in their colon, you can imagine why not only from a sense of level of discomfort and not feeling comfortable having sexual intercourse, because they may even have bleeding at the time of intercourse from their rectum. They may even have
Mm.
a bit of diarrhea and mucus come out just with the pressure of having that physical activity. It will also cause quite a bit of pain. I mean, with
Oh.
sex, we have to be in different positions. If someone is on top and applying pressure right on the abdomen, that could cause a lot of pain and even cause pain with sex in itself, with actually just the insertion of the penis into the rectum, into the vagina itself. That could be very uncomfortable. So lower abdominal inflammation and pain in colitis can be very uncomfortable for a patient.
Yeah, I guess, it's interesting because you never, at least I don't think about that because it's not in my, not something that I see every day.
Mhm.
Where, I think you make a very good point about patients that experience Crohn's, that have Crohn's and ulcerative colitis, and the amount of abdominal pain that they experience, and the bloating and the pressure, right? And
Absolutely.
just like what you said, with different positions in when somebody's sexually intimate, that it could definitely affect it, and they would have to probably navigate that, right? They probably have to choose or find positions that wouldn't irritate their abdomen, that wouldn't irritate their bowels, and so that would be the least discomfort for them. So
Absolutely.
really interesting. And I, didn't even think about the fact that, there could be pressure from the vagina onto the rectum,
Right.
and that, right, you could have some of, like, discharge from the rectum come out,
Absolutely.
and
Yes, you
how,
can.
that might be very embarrassing for the
Right.
patient.
That's
And that might,
uncomfortable. Right. Absolutely.
right, right. And just they may not want to be in that type of situation, always fearing what may happen. So,
Yeah.
really good point. I'd like for you to discuss, if you could, just a little bit about, I know because you're a functional medicine doctor, just a little bit about the microbiome of the colon, and how you, as a functional doctor, make recommendations to your patients that may be experiencing bloating or discomfort with certain foods and things like that.
Okay. So the microbiome as a whole, it's
Yeah,
a
like that's another podcast.
yes, that's another part. We've just created the fourth podcast right now. The
Yeah, that's right.
microbiome is a whole topic, but I do want to talk about certain foods that could exacerbate bloating, and then I can
Mm,
touch on certain foods that could increase inflammation. So if you know
okay.
you have any of these conditions, what are the foods that you want to avoid, and what are the
Mm,
foods that you want to eat more of, right? And so
mm,
in terms of bloating, and I'll relate this to maybe the diagnosis of irritable bowel syndrome, but we can see this in inflammatory bowel disease like Crohn's as well. You want to avoid foods that are really hard to digest. And these are going to be essentially legumes, right? So
oh,
lentils, chickpeas, beans are really hard to digest and typically cause more bloating. Generally, if you eat a bunch of beans, you feel bloated. Even a healthy person, right? If you eat too much, you're going to feel bloated. Now, someone who already suffers from IBS and bloating will feel a ton of bloating. So there's
mm,
actually a therapeutic food plan we often recommend to our patients called the low FODMAP diet. And with that diet, what you're trying to do is avoid foods that are high in FODMAP. And FODMAP foods are a range. Actually, it's like fructooligosaccharides and polyols. They're types of foods that result in, when broken down, can release quite a bit of gas into the system. So you want
Oh,
to adhere something called the low FODMAP, and it is FODMAPS, low FODMAP diet, that helps reduce bloating. And I often
mm,
tell patients, so stay away from the foods that are on the list.
yeah.
So that will generally reduce symptoms. And in terms of inflammation, when our patients have, Crohn's, colitis, and they're suffering from discomfort and a lot of inflammation, simple things as just reducing the intake of dairy helps, right? Because we know dairy is very pro-inflammatory, as well as sugar and
Mm,
gluten-based food. So not eliminating completely, but certainly reducing, because we know that those are definitely pro-inflammatory foods that can affect the gut. And so until you really have healed the gut and resolved the issue and gotten the adequate treatment for your Crohn's or IBD, those are foods that you can minimize. And when it
mm,
comes to how to strengthen your microbiome and give your microbiome the right type of nutrients to feed, the right type of bacteria that are helpful for your gut, I always recommend that patients really try and focus on a rich plant based diet. So, as much fiber as possible. Fiber is really the key word when you're trying to improve your microbiome. Fiber feeds the good bacteria and helps them thrive. And bacteria in your gut is responsible for breaking down nutrients, making micronutrients, helping with motility, strengthening the immune system, so many things. So anything
yeah.
you can do to improve the commensal, like the good bacteria in your gut, you definitely want to do. And that would be, definitely increasing fiber through plant-based foods and really avoiding processed foods. And when we say
Mm,
processed foods, we mean anything that you have to go run through a drive-through to get. If you have to run through a drive-through to pick up the order, for the most part, it's going to be fast food and it's going to be processed, right? And so avoiding processed foods, anything that comes in packages and bags and things that could be sitting on a shelf for many, many years, that's all processed foods. Those are foods you want to try and minimize from your diet. I hope
mm.
that was helpful. It was a lot.
Yes, it was so helpful. I was trying to memorize all of that
Not
while you
memorize. You
were
can listen
while
to
you were
again. You can listen to the Muslim Sex podcast over and over and over again. Yeah.
That's right, to get that information. So you had said to avoid foods that were, aside from being processed, but you talked about dairy and sugar, inflammatory. And what was the third one? I missed that.
Gluten.
Gluten.
Yeah.
Gluten is found in flour,
In
right? We're
wheat,
talking
yes, flour, wheat, yes, yes,
wheat.
yes.
But then how do we increase the fiber? I guess maybe just take like
Fruits and
plants and vegetables.
vegetables. Yes, absolutely. Lots of fruits, lots of vegetables. And, they say we should be eating 2 servings of fruits and vegetables at every meal. So either fruit or vegetable. So for breakfast, you want to have an apple and then you want to have, you're laughing. So did I. I was like, really? What did I eat today? What did I eat? I better go eat up. So one serving, well, like an apple, and then you'll have like, an omelet with spinach in it or with mushroom. Boom, check. You've done your 2 servings. And then for lunch, the same thing. For dinner, the same thing. We love our carbs right here in the States, and we probably eat way too much. So just backing off and having a nice diversity, making sure you're including veggies in your meals.
Yeah, so 2 servings, I have to remember that. So 2 servings of fruits and vegetables.
Yeah. So like a
I
fruit or
remem
a vegetable, that's 2,
Yeah,
right?
yeah.
Yeah.
Okay, lots to remember. This is such great information. I hope everybody's taking notes.
Yeah.
I'm doing the podcast, but I'll go back and take a listen and then I'll take notes. Well, this is fantastic. Yes, Alan is taking notes as well.
Taking notes.
That's great. For the audience that doesn't know who Alan is the podcast producer, so he's also taking notes. But
Thank you, Alan.
this is, yes, that's right, Alan. Hopefully, Alan can put him in the show notes, which would be so helpful.
Yes.
Um, So tell me more. I just want to keep talking to you. This is such great information. So we talked about intimacy. We talked about how GI disorder, not disorders, but GI issues can affect intimacy. We talked a little bit about the microbiome. Um, any more pearls that you would like to give our listeners? We talked about increasing fiber through fruits and vegetables, not necessarily through gluten or wheat, which is what I think of. I think of bread. I think of whole grain. What about whole grain bread? Not good
No,
or
no.
good?
So no food is bad except processed foods. I don't think we should label any food as bad because that stigmatizes food, and then people start having food restrictions, unnecessary food restrictions that they
Right.
don't need to have. You just kind of have to connect with your body and really understand how your body reacts to certain foods, just
Mm,
by connecting and observing your symptoms. So if you don't have issues with inflammation, like, and you just want to be healthy, I think the key again, I think, is moderation, right? It's a well
yeah.
balanced diet with a bit of everything. So whole grains, not an issue at all. Whole wheat bread, if that's, you have no issue with it, absolutely not an issue. So I'm not telling everyone to avoid gluten, dairy, and sugar, but I am telling people who have chronic inflammation, um,
Oh,
and are eating perhaps a lot of these foods, that these foods, a lot of carbs, a lot of bread, a lot of dairy, a lot of sugar,
yes.
does not enrich in your microbiome. So
Got it.
plant-based fiber is definitely the way to go. Yeah,
Mm,
it's definitely
yeah.
the way to go in that respect. Yeah.
Got
Something
it.
else to add, we haven't talked about fistulas, and this may have
Tell me.
come up in conversation. So fistulas are little tracts that form between sort of even the vaginal wall. It can even form with the urinary area as well as the anorectal area. Sometimes it starts with a little abscess, and it could just be a benign abscess, and an abscess is a pus pocket, right? Or
Mhm.
sometimes it could be related to a chronic inflammatory state, like our patients with Crohn's disease who develop these fistulas. And important to know, something that I think is very obvious to me as a gastroenterologist, is that uh, when you're treating fistulas, sometimes you have to clean them out and make sure they continue to drain. So you
Mm.
place these little catheters called setons. And these
Oh,
setons allow the fistulas to stay a little bit open and continue to drain out whatever pus so that they can heal from the inside out. So as a female gastroenterologist, I see a lot of women who have Crohn's disease, who've had
mm,
fistulas, and they have these little setons hanging out of their anorectal area. And I can only imagine that during sexual intercourse, that can also be uncomfortable. That is
yeah.
probably not pleasant if you don't know the partner that you're having intercourse with. They may not have seen this before and wonder why you have these little strings and cords hanging out. And then if you have a partner who's familiar, they understand how to kind of maneuver and move away the seton so you don't, mess with them and remove them, to allow for penetration. So there are actually some physical things. There's some, physical things that we insert in our patients with anorectal fistulas and anorectal disease that could actually affect sexual intercourse itself, simply because not necessarily cause pain, but maybe a little uncomfortable for some people. And I think I want to highlight that because some people in your audience may have fistulas and have setons placed and have to deal with this, or explain it to their partner as to what this is for.
Yeah, that's fantastic. I'm so glad you bring it up because, there are definitely a lot of people that deal with chronic diseases and, we just don't know what they're going through and how they have to navigate their relationships based off of their disease,
Yeah,
right? And how comfortable they feel with their own bodies. There may be some body image issues there. They
absolutely.
may, not desire to be with anyone because of all of these issues with fistulas and tracts and having surgery and
Absolutely.
right they may need recurrent surgery for their fissures. I
Absolutely.
know that's something that I haven't touched on, which is something I think really important, are fissures and fistulas, actually fistulas rather, that develop that can develop in after childbirth,
Birth,
right?
yes.
And fistulas, such as we know that you can get those rectal fistulas if they had a laceration or a tear in their vaginal rectal area, and then it didn't heal properly. I know a woman that had the a fourth degree tear,
Hmm.
which for those people listening that do not know what that is a tear in your vaginal area, right? The perineum that then goes and extends into the rectum. So
Hmm.
that's a fourth degree tear. And what happens is that, as OBGYNs, we heal it, we repair it. However, if it doesn't repair properly, then it can form a connection between the vagina and the rectum. And I had a friend who actually had to have three, four surgeries
Really?
before it finally, yes, here in the US. It's not even like it was, overseas or anything like that, but it was here. And she had to keep going back. And again, it's, something to talk about physicians not believing their patients, right? Like they were like, no, it's fine. It looks fine. And she's like, no, there is a connection. There is a problem that's going
Mm.
on. So she did have to have a few surgeries before that was finally fixed. And that was horrifying for her,
Wow.
that she had to keep
Yeah.
going through that. And we know that when I was a few years ago, I spoke to a urogynecologist and I had her actually come and lecture. And I was part of this interfaith group that we were collecting supplies to send over to, underdeveloped countries for like birthing kits.
Hmm.
So they were, we would give them like supplies and things like that. So, anyways, we had a urogynecologist come and talk about fistulas that she had seen when she went to Africa in women that had protracted labor. So these poor women would have, because the hospitals were so far away from where they lived, that once they went into labor, that oftentimes they'd have to walk for a day or so to get to the closest hospital. That then, if they were in labor that long and that baby was stuck in that pelvis, you can imagine that pressure of that
The
head,
picture,
that
right?
fetal head,
Right.
crushing the tissue,
Hmm.
that then leads to, formation of that fistula happening between the rectum and the vagina.
Yeah.
And then, by the time that they would even reach the hospital, that fetus would be dead
Mm.
because it was stuck.
Hmm.
And then, aside from the trauma of delivering a dead infant, they'd
Hmm.
have this trauma of these fistulas, and then they couldn't go back to their own communities because they would either, if they had like a urinary fistula, they would leak urine, or if they had a rectal fistula, they would leak stool, and they were ostracized, and it was just very, very sad. But right, so like just what you said, that there are a lot of issues with fistulas that we don't talk about, and how that impacts relationships and a person's life.
Yeah, absolutely. And I think the last thing I want to highlight, because I really want to make sure that we are relating to everyone who may be listening to the podcast. As a gastroenterologist, of course, my main job is to prevent colorectal cancer, right? And so I
Yes.
perform a lot of colonoscopies. But sometimes, and I want the audience to remember that colonoscopy screening, we start now at age 45, no more at age 50. Make sure that if you're 45 and up, this is fully covered by your insurance, get screened because colon cancer for some reason appears to be on the rise, especially in
Mm,
our younger population, 35 and up. Very
really?
much higher incidence than we've ever seen it. But I'm thinking back at a patient, and who's now become a dear friend, whom we diagnosed her colon cancer at the age of 42. And
Oh.
it was quite aggressive. It was a stage 4 when we diagnosed it. And the surgeons, actually, the colorectal surgeon's opinion at that time, because of the location of the cancer, was to do a diverting ostomy. So she has an ostomy bag. And since we're
Mm,
talking about intimacy issues and how that can affect sexual intercourse, I think it's important. We just talked about, what physical things do we insert in people's bodies that make intimacy difficult, and even the question of broaching the conversation with your partner as to what is this. A big one, I think, that's a big stigma that we're really trying to remove as a taboo in gastroenterology and just oncology and cancer patients altogether, is that ostomy bag. It is a completely different orifice for stool to be coming from your abdomen into a bag. It is unnatural. It's very, very hard in terms of just the amount of, it's traumatic for a lot of people. It takes away a certain, I would say, even sense of identity, in terms of who am I today and what's going on. And we're talking about chronic disease, and this is something you have to live with chronically for a lot of people. And so that ostomy bag is a big stigma for a lot of people. And some people actually don't want to have partners again. So this friend of mine got her ostomy bag, which in some ways the surgery saved her life. And I was talking to her a couple of weeks ago, and she goes, Viv, I don't want to have a partner again. I just don't see how I can even broach the conversation of this ostomy bag with a new partner, because she wasn't married, and she didn't have a steady significant other, so she was still in the dating pool. And I was just crushed. I was just crushed. So I shared a lot of resources. There's so many great platforms and support groups, women empowering groups, and just general men and women empowering groups about how to live with your ostomy. And I shared that with her. And on that platform, she was able to meet another lady, a really sassy 60-year-old who was also single and still dating and had her ostomy. And she talked about how she didn't let the ostomy bag define who she was and define her life. She just lived. She just lived, and she continued to live. And, she continues to coach and mentor my friend. And I hope that eventually she also decides that, she has a second chance of life, and she should use it wholeheartedly to 100% and just live. So that ostomy bag is tough.
Thank you so much for bringing that up, because I think that that is something that we forget about. And you are so right that, patients or people that have to live with ostomy bags, that's a different type of disability that we don't really, it's not really a disability, but it affects their body image, right? How they see themselves and how they identify as a person. And I think that that is something that it's really important that we talk about more often, so that the conversation is normalized, so that they don't feel as if they are an anomaly, right? That there's something wrong with them. And of course, it's not anything that they did, it's, and like you said, they do have a second chance at life. So, it would be great for them to also find a partner, somebody that shares and that understands their experience, and so that they're not made to feel as if there's something wrong with them. So I think it's so important that you brought that up, and I appreciate that. So thank you for doing that. It's very important that we talk about it and normalize that conversation. So, any other pearls that you want to leave us with before we end this podcast and schedule our next one?
I think I'm tapped out in terms of this topic. I have really tried to think of all GI issues from mouth
Right.
to anus. I mean, yes, we could go on. We can talk about halitosis, but you know what? Let's save that for a
Yeah.
different.
We will save that. All right.
Save that
Awesome.
for a
Well,
different one.
thank you so much, Dr. Asamoah, for coming on and telling us everything GI related. And it was such a great conversation, and so awesome for you to discuss all these topics. And gosh, so many great topics that we covered. So thank you so much. So for somebody that is listening and watching and wondering, wow, she is awesome. I wish you were in New York. I definitely would come to you. But for
We could
somebody
work
that
in New York
is
too,
sitting,
just chilling, not doing gastroenterology.
well, I guess when you do come out here, we can hang out then.
Absolutely.
Um, But so for somebody that's listening and wondering, like, hey, I'd love to get in touch with her. How can I get in touch with you? So, how can patients get in touch with you? Those that are interested, just to kind of find out what you do and learn more about the microbiome and what they can do to help their inflammation. How can they get in touch with you?
So I actually do see patients virtually as well. We do a lot of telehealth in our integrated functional program. But you can find me on vivianasamoah.com. That's my website. And the same social media handle on all platforms: LinkedIn, Instagram, TikTok, and Facebook. I'd love to invite your audience to my tribe, so your tribe can meet my tribe. And we are on a platform on Facebook called the Natural Gut Relief. And it's a
Mm.
private Facebook group where we talk about everything natural, plants, natural supplements, herbs, natural techniques that can be used to find gut relief or heal chronic gut issues, right? And so the
Mm.
platform is called Natural Gut Relief. We share a lot of resources. We also have invited speakers talking about different topics every Thursday. So, a wealth of information and a wealth of resources. And I'd love to meet your tribe there.
Sounds great. Well, thank you so much for coming on. And it was a fantastic conversation. So, thank you so much. And well, I am done here, and it's been real and really intimate. And again, this was not meant to be any type of medical advice. So, if you have any questions about your gut health or really anything about your health, please see your friendly neighborhood medical doctor. And until next time, this is the Muslim Sex Podcast. So, thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So, be sure that you share it with all your friends. And thanks for listening.